Elena, hi, and thank you so much for joining me here on Faces of Digital Health, and actually in a special series that I call the Agentic Patient, where I am trying to explore, how people use AI, how people even develop their own companies, with the hope to just get more clarity around their health that they didn't get through the healthcare system.
Mm-hmm.
And you have such a story where your symptoms or your exams that were done in the medical system weren't kind of taken seriously. So I will let you explain, how did you decide to focus your expertise in AI and in data science, and you applied that to healthcare?
Thank you, Tjasa. It's a pleasure to be here. It's such an important topic. I've studied machine learning for 2 decades now. I've been working in the academy and the industry space, developing dynamic systems. And, initially I studied and did some prototyping at Google, joined Reddit, built these kind of systems at change.org, as well as all of my previous companies. And so I have always believed that AI technology is one of those superpower forces that can help us solve difficult problems in society. Watching people that I love and watching my mom struggle and going from one specialist to another specialist, not finding answers for her health, for her problem. Ultimately, I lost my mom in that battle. And then later on, when I started experiencing struggles with my health, as most founders do, because doing this job is incredibly taxing on the body, and you start developing various kind of mild dysfunctions, and which can become bigger problems. And so oftentimes those are the things that are dismissed. Doctors usually run the labs, they see normal labs, they can't explain the symptoms. And oftentimes what we hear is that it's really in your head, nothing's wrong, you're just stressing too much, maybe just don't stress too much and you will be fine. I just, knowing like what happened to my mom, watching that journey, I just couldn't take that answer anymore. And that's when I decided that I'm going to use my skills, everything that I've known so far, all the knowledge that I've gained from building dynamic systems throughout my life. That was my PhD, actually, learning from infinite streams, seeing everything as a complex system where things are constantly changing and interacting with each other. That perspective enabled me to kind of think about this problem, in that similar way. Diadia is the first clinical reasoning, causal reasoning AI that can connect the dots across your bloodwork, biomarkers, your full genetics, microbiome data potentially, any other diagnostics, and then surface the real root drivers of disease, the real reasons for why something is happening in your body. Not just that showing you what is high, but really what is this upstream or downstream from? Like, what are the pathways? What are the explanations that show how has this developed and where is it going in the future? And then this information we give to clinicians as a clinical decision support tool to identify and finalize the right protocols for you. The AI does prepare the solutions, the protocols that are recommended for your unique biology. The clinicians can revise them and review them and interrogate them and ensure everything is safe and right. And then work with you on a plan that makes sense for you, for your, stage where you are in, your ability to commit to changes. In that way, we work on helping prevent small problems from becoming bigger, but also resolving complex cases where current traditional medicine doesn't have the answer to resolve, like it doesn't have the tools to actually understand the data, the patient information properly.
Mm-hmm. And what types of data do you need to create any recommendations, and what type of recommendations are we talking about? So does the tool recommend existing therapies? Does it recommend a change in lifestyle? Let's try to maybe explain this on a concrete example of a patient case.
Yeah. So at the minimum, we require a comprehensive panel and ideally to full genetic sequencing information. That's the AI will work on the panel as well, and it will find relationships between the various systems that exist and that interact in your body and explain things in that way even better than what you'd normally get by just like looking at things in isolation, like, okay, your iron is low or your vitamin D here is low. But what is the connection between these two things? And what is the connection between those data points and your TSH value? That's not something that doctors are doing today. Medicine is designed to work in sort of like specialties, right? So you have a doctor who is specializing in hormones, a doctor who is specializing just in, let's say, your gut or your heart and your skin, etc. But everything is interconnected in the body, and you can't like look at things like that in isolation. And so, if you have the idea today, your doctor can, in essence, take that blood work that they've done, upload it into the system, and I see the relationships between how small changes in a few of those, biomarkers in a few of those lab results point to dysfunction in a few of these systems as a whole together because they interact with each other by understanding the relationships between these things. If you add into that genetic information, now you're going to be able to understand why these things are like this. Even when things like are still in normal ranges, it can explain why you may be having these symptoms and point the doctor to deeper testing.
Mm-hmm.
But
is that what you used when you were trying to analyze what's happening with you? So
yeah.
Basically how long was your patient journey before you got to any answers? And how do you think that your patient journey would be different today if you already had a tool like this?
Well, my real patient journey, all of my life, I've always struggled with this minor things that seem unimportant, but the inability to lose weight, like despite working out, despite eating healthy, despite avoiding sugar, despite fasting, despite doing extreme diets, I've always felt cold. And, over time, as things gotten worse and worse and worse, these signs were there when I was even much younger, like, around 20. And doctors could have seen these signs even then that I have likely thyroid issues that will develop further in the future into bigger problems and even pre-diabetes, But no one was seeing these things. No one was alerting me about these things. And when things started getting really much more difficult and visible, I was getting more and more frustrated with the system, going from one specialist to another specialist, from a gynecologist to an endocrinologist to another doctor, and all of them not connecting the dots, the information. So once I started digging into this on my own, I started realizing that the knowledge is there. We know how genes interact with nutrition, with medicine, with stressors. We have all this information. And so I think it took me 2 years and a half throughout the entirety of building the idea, really, to figure out what is wrong with me, step by step, digging deeper and deeper. And now, I think I feel like in great health. I feel so empowered. I feel like I don't need doctors anymore. I can manage my own health. Yeah.
Well, hopefully it stays that way for as long as possible. It really is, today, for example, if you just look at 5 years ago, we are in such a different world, especially with AI, with generative AI, with large language models, because suddenly it's very easy for every individual to create a multidisciplinary team of clinicians that will look at a particular symptom from their different angles based on their specialties. So how do you see the rise of AI in patient journeys? What kind of prompts, for example, would you use if you didn't have your company, but just had chatbots and you would go to them instead of the doctors to inquire about your symptoms?
Now that I know what I know after building the idea, I would not do that actually anymore. I would not go to the chatbots and ask them
Why?
questions because of two things. Number one, they've gotten to a stage where they look very convincing, and in fact they're actually doing something which we call fateful hallucinations, which means that they're making small mistakes. They're not following the instructions properly. They're fabricating little details that may not be true based on like patterns that they're basically seeing in their training data. So it all kind of like sounds very confident and plausible, but don't have the expertise to truly evaluate if that's true or not. And so you won't know pretty much that they're actually guiding you towards something potentially a wrong conclusion that's for you. Your data does not exist in isolation. You really need to kind of like allow it to look at all of the information at once to truly identify what's true for you. I would have asked things like, oh, how can my genetics explain the fact that I have this biomarker value, but my doctor says this is normal, kind of thing. and then that's what I would have asked. But then in that explanation that it would give you, some of the things could be plausible and some of the things could not be plausible. It's going to give you a bunch of things all at once, and you're kind of there wondering what we should be going after, what is real, what is not. And the worst thing is that you take that to your doctor and then they're wondering themselves what is real and what is not, trying to figure out. It's very easy to spiral, and when it starts flagging, you have a high risk variant for that or for this. Is that really expressed in your body? What's the context? Like, is that really a risk that is currently real for you, or is it just something that could be? It's plausible. These models don't have that kind of information. They're not plugged into the real world. They're just generating possible ideas and explanations that may or may not be true. And so that's kind of like the danger that around which we've built our whole new technology, our whole causal reasoning framework, to avoid those pitfalls for both patients and the doctors.
Mm-hmm. So what kind of technology are you using at the moment with your tools, and how do you also position them in comparison to large language models based clinical decision support?
Yeah, I mean, that's a really great question. I love that everyone should be sort of asking any AI in healthcare. How are you deriving your own conclusions for the doctors or for the patients? We basically don't use generative AI for clinical reasoning. We've built our own proprietary and patent pending clinical causal reasoning engine that pretty much traces the thinking process on a structured graph where we can connect the dots between every piece of evidence and ensure that the evidence leads to the final conclusion in a logical way, just like how a human would logically reason across pieces of evidence. But we ensure that that connection is made from the beginning till the end of that reasoning chain. Sometimes they converge from multiple pathways coming to the same conclusion. So we use this kind of new technology that will find the let's put it this way, the thoughts, the ideas with the most evidence based on what information we got from neurobiology, from the clinical research, the health things that we have learned as a society, from 310,000 peer-reviewed research papers, 700,000 and more million, basically genetic variants, and then rank them, show you the upstream and downstream effects, the connections, the causal basically relationships within things, and order the problems into clinical priorities such that if you solve the ones at the top of the hierarchy of problems, you're going to have the most positive downstream effects on the ones below, which means that you're going to solve multiple problems at once. So that, you don't really work on solving symptoms. You're working on solving the root drivers, the causes for this, metabolic dysfunctions, hormonal conversions, things that are part of a system level dysfunction, a disease in progress.
You talked a lot about, how large language models are very specific. They can hallucinate. They can take you in the wrong direction. However, we know that clinicians use them either officially or in shadow mode, so shadow IT or shadow AI. Patients use it. Some patients solved their issues by, digging deeper, importing all their medical data to large language models, adding additional context just to get to some insights. So we did see already that it can be useful when used right. You were mentioning that you are looking at data points and papers that are validated. But what happens when suddenly all the reasoning or increasing amount of reasoning in healthcare is managed by AI, meaning that, we are starting to rely on AI recommendations. And with this, I mean large language models, not other types of AI. I just mean chatbots, which basically narrows our points of view, kind of the chatbots are in a way potentially taking over our thinking. What I mean by that is, how do you think that might potentially also impact, the data sets that you are drawing insights from, if the thinking is offloaded to chatbots to a degree?
Where things will go if doctors continue using chatbots and not clinical AI.
Yeah.
Yes, it's so. I think a lot of wrong conclusions will be drawn over time. On one side, yes, people are just throwing in their data and there is no proper learning loops where you're basically figuring out whether that was the right choice for this biology. Have you really fixed things? You're still looking probably at things in isolation and kind of making broad conclusions that will apply in some cases, will not apply in other. It's a dangerous game, pretty much. I'm gonna say. Right now, models are sort of averaging things. They're not really looking at the uniqueness of your biology and what makes sense for your current situation, especially if you look at all the things all together connected, and making broad cookie cutter style protocols like we already have. Medicine will not progress forward. We're just going to have potentially more mistrust generated because of the mistakes that will happen, and trial and error will remain the same or worse. Doctors might get frustrated even further with these tools not being really helpful. Without the proper guidance of where their limitations and what is not known, people will be making wrong conclusions, and I really worry about that kind of a world.
Mm-hmm. Mm-hmm. If I just go back to the point where you said that at the moment some solutions are not taking into account what's your specific situation and what is kind of normal for you. Normal can mean different things for different people. So, for example, normal lab results. If you have a particular condition, a lab result that looks abnormal in someone else would seem normal in the person with a condition. For example, if my hemoglobin drops because of IBD, then which is the inflammation of the gut, which is seen with bleedings, internal bleedings in essence. So doctors would see it as normal in a way, that the hemoglobin dropped. Yes, they would treat it, but it would still be perceived differently than in a normal person that suddenly has a drop in hemoglobin. So how can AI be used to redefine what's optimal and what's normal in different people?
Yeah, I think this is one of the biggest problems in medicine right now, that, we've been patients' labs are being read through the lens of a really old methodology that was predominantly actually built on male data to begin with, and now it's applied universally to women, to different ages, to different ethnicities, to different genetic profiles. But in reality, because of the uniqueness of our biology, we know today that genes are pretty much affecting where your biomarkers kind of converge for multiple decades. So your genetic profile identifies what is sort of a predisposition that will last for you for multiple years, and explains why that's happening because of the interactions between everything else. And so what the opportunity that we have, that I'm extremely excited about to be a part of and actually bring into this world, is to use technology like AI to really understand what is truly optimal or normal for you that would not be normal for someone else, because of understanding, how the genetics are actually uniquely affecting your enzyme levels activity that, basically control how much hormone you convert, how much nutrients you convert, how much of that is available to your body to function properly. And so a TSH level of 2 point something might be completely normal for one person, but in you might actually hide a fact that your thyroid is working kind of hard and trying to produce enough of hormones, and your body still doesn't have enough of the free T3 hormones, of available hormone that manages your energy, manages your mitochondria and your health and your hormones. And so your genetics can be used to identify, because of the interactions of things, what actually is not normal for you and is hiding a dysfunction, and another person means completely something else. That's the power that I see. And over time, we would be able, once we continue collecting this, I call it subclinical data, which means this is data on people who are not diagnosed as with the labels that we have today. Like, you have this kind of a problem. We don't have this information because your symptoms are still mild. You've not yet developed enough of comorbidities and problems to call you into a comprehensive testing. And so we don't really know what's happening to you until the point you get really sick. Now that people are testing more and more, we have available, blood work, hundreds of biomarkers for a few $100s. You can actually afford to test at least once a year, ideally twice. And you start to create that subclinical data for what is going on in your body across multiple biomarkers before disease fully develops. And that will help us identify, together with your genetic profile, really the right way of looking at your labs and reading what are the ranges that are for your set of genetics, ideally optimal for you. And that will guide doctors what they should be shooting for when they're trying to improve your health. So where should your TSH be? Should be maybe closer to 1 instead of 2 for you. And for another person, it actually 2 is fine,
Yeah. You alluded to the fact that, with more accessible testing, we have increasing amount of data, and especially when it comes to women's health, the lack of data, the lack of research is one of the big challenges to just help women faster in a way. So how do you, in essence, see this issue? So do you think that basically new findings are going to come from the fact that patients are testing more on their own, and because commercial providers are going to have increasing amounts of data, new findings will be able to come out of those data sets, because public research doesn't have enough funding to do and gather all the data that is potentially being gathered through direct-to-consumer products for genetic testing, for example.
Yeah. I do think that institutions who are working at this forefront of preventions will probably be collecting the best data because consumers are demanding better health. They're needing better solutions today. They are aware that better health is possible with the help of AI, that even though it hallucinates, it does create awareness of all the things that could be in play and need to be validated and tested. And so we will see a lot more people testing and, in fact, frankly, sharing their data, because with the interoperability changes that went in play in the United States specifically, anyone can share their data with whomever they want for the purpose of getting better health with whichever doctor. So the patient owns their data and they will be able to move it around. And so at some point, I believe it will definitely reach research as well. But initially, companies who are working at the forefront of prevention will have probably the best data sets.
Your company is providing a clinical decision support for clinicians. You are also available to patients. So from that perspective, how do you see, the changing relationship between clinicians and patients, with the changing access to data, with the changing understanding of what the data means, with the help of AI? So how do you see that relationship might change in the future because of these changing dynamics?
Yeah, no, I definitely think that I see a future where doctor-patient relationships are actually strengthened by AI and not weakened. That's why we actually have a patient, we're available to patients directly, because when doctors and patients become more empowered with information, both sides, however, there is the potential, the best version of the world of the future where the AI handles the computational complexity, avoids the mistakes and the pitfalls, is able to analyze multivariant, perform multivariate analysis across all of your biological information that doesn't take a huge amount of time, and it's basically not posing unrealistic strains on the existing system. Both sides are empowered to make the right choices together and build, a partnership towards best care possible. But right now, the reality is that many clinicians, on both sides, are actually frustrating. Patients feel unheard because of just a 15-minute time slot that usually doctors are able to give to them, and they bring in their data and complexity of symptoms, and the clinician feels overwhelmed with all of this information. They've not run it through an AI or not sure they can trust the analysis, and even this AI that they have is kind of like not also reliable. And so it feels really it's a frustrating relationship and situation for both sides. But a technology like ours, I believe, can change that dynamic, because now the clinician can walk in with both sides are empowered basically with the tool. The clinician walks in with a technology that has already done a comprehensive evidence-based analysis on everything that's going on in that patient's body. The patient is also informed, so now they have more time to do the things that only humans can do, which is listen, show empathy, apply judgment, co-create a plan together that makes sense for the person's life. Because oftentimes where treatments fail is, okay, we know what to do, but the patients are not doing these things. And then the reason they're not doing these things is because it wasn't realistic, the way that it was set up for their life. It wasn't well explained, the importance of it. It wasn't adjusted. It wasn't working really well initially. So I only believe in a great future, actually, AI will be our best evolutionary partner to handle the complexity of human biology and disease, and actually, create a new kind of medicine that we don't have today.
Yeah. The potential is definitely there. I think there's a lot of excitement on both ends. I know that you mentioned that people need to be cautious when they interact with chatbots, but still they are being used. So from that perspective, if you had advice for people in terms of how to use chatbots that are out there, or AI more broadly, so AI that is accessible, what would your advice be? What should people definitely not do? What could they potentially do? what comes to mind when you think of all the technology that's out there?
Well, they should not be throwing their genetic data into ChatGPT and other OpenAI. I would say start there first. Like, you want to know and ask every platform, who has access to my data? What do you do with my data? Is, like, my data being used to train the models, and how? Would it be sold or shared? Are you HIPAA compliant? Are your business partners HIPAA compliant? Do you have BAA agreements with all of your partners? Genetic data is very sensitive. There's so much power in it, honestly. And I really think everyone should test, and they should use it in understanding their health, and especially like interpreting their biomarkers at the minimum. So just looking at genetic data on its own is not healthy. You don't want to worry about the gazillions of risks that you will find, because we have a lot of genetic variants with high risk variants that have certain potential influence, but it's the interplay of genetics and the environment, the stressors and toxins and these systems that interact with each other that determines what sort of risks you really have, not on their own. So when you throw data into ChatGPT style or OpenAI models, you are allowing that data to be potentially leaked into places you don't want it to be leaked. To begin with, insurance companies can use this information to change what you might get as a protection, as insurance, and the rates, how sick or dangerously sick they perceive you are. You have no control once it goes out, where it's going to go and how it's going to be used and what kind of conclusions will be made for you. And so, you want to be careful about that. Patient privacy for us is really fundamental to everything we do. Our business models are not designed around data selling or sharing. If something is free, I always say you are the product, So think about that. So basically they're selling you, it's not free.
Absolutely. It is, I think, a topic that we will need to talk even more about, because at the end of the day, it comes back to when are patients willing to share their data. And oftentimes when you have a big medical issue, and when you are under stress, when you are anxious or worried, then the guards that you have on for data protection lower to a degree. Or when you ask patients would they share the data to help other patients, then they're also more open to data sharing. And especially with AI being very convincing, very pleasing, very flattering,
confident.
Yeah, exactly. It's also, people can also, I won't say that they are manipulated into sharing data, but it's definitely easier to let them know, to convince them to share the data. So yeah, definitely, I guess privacy is going to be a big thing to discuss in the future.
Yes, for sure. And I honestly, when I think and worry about the fact that these open models, the already growing insatisfaction of patients with the care system, which is putting them to share their data more broadly, are going to create a few more other problems. Besides the fact that self-treating inappropriately, people basically, because of this confidence that models show, they would choose to take certain treatments on their own, and I've done it myself. So I know, it's not wild to think that's going to happen. Another thing that's going to happen is anxiety amplification. You're just going to start looking at things and start worrying too much excessively, and because of not really understanding and taking things out of context, we're just gonna have more anxiety about our health, which may not be really realistic. And the third most important thing is the equity dimension. I think the people with more resources and more education and more finances will be able to get more out of these tools, because they'll be not using the free versions. They'll be using versions where things are properly handled, and they'll be using doctors who are using AI that is not free. And that will only enlarge the existing disparities between people with resources and without resources. And that's why I really, really believe that clinicians should be at the center of all of this. They should be involved in using a technology that is safe, clinically validated, that is a powerful reasoning tool that gives them more information and a way to learn themselves and a way to safely guide people into, let's put it this way, new territory, because we've not tried some of these things on a large scale, but we should, because there is a huge potential and evidence already that it will work. But it has to be done with a clinician at the center of everything. And I do think that the human relationship in medicine is not a bug. It's a feature. It's something we need to have.
Yeah, absolutely. So how many clinicians do you work with your solution? Can you tell me a little bit more about, how you went from the idea to product development, to testing, to deployment?
We had a very unusual path to building this whole product. So I because of my personal health story, because I was the patient initially, I was the consumer, that was trying to find answers and trying to use this open AI to find solutions for myself. I realized that how bad care is, and had spoken with many doctors, and the central narrative is that you want to create demand on the patient side, and you want to basically raise the bar of what quality is and solve these solutions by ensuring that the patients are the most satisfied first. They're really like finding the reports, the insights, the solutions really helpful, and will feel more informed, and their concerns will be explained. So we actually went initially from a direct-to-consumer side of things. We partnered with a few clinicians with whom we are working with, and we've had, done thousands of cases of patients who shared, their data with us, and we designed the product alongside that sort of collaboration, running multiple clinical iterations, ensuring that we are surfacing the right kind of things, we're prioritizing things properly, and we are actually seeing improvements in results in patients. So now that we've validated this, we have, we've reached a 98% of agreement with clinical judgment of the reports, and we're seeing in early data 60% less trial and error in resolving symptoms. So we've been able to solve things that patients were trying to do for multiple years with their clinicians. When they came to us and we gave them the reports, they took them back to their clinicians, and they made changes based on those reports, and things started immediately changing and shifting for them. Things that weren't diagnosed for decades were all of a sudden, wow, I can see that you actually have endometriosis, and we need to do these things for you. So that was a very unusual process, and then we discovered that all these things that I've learned, which is that people, when they start seeing a very complex information around their genetics and their body surface to them, they start to spiral, they start to feel more anxious. And we also understood that there is so much potential in understanding human health that hasn't been done yet and needs to be in the hands of clinicians. And so we open it up to everyone now. We've been on the clinical side of things live for a few months. We've had really great adoption. Doctors really love the fact that it's transparent and easy to use. And so we've been we already have about 15 clinics to 20 in process with us, trialing the technology, using it with real patients. And, we're basically adding a few every week.
Well, congratulations. Where do you hope to have the biggest impact?
Where do I hope? We already are seeing impact.
Which area? I'm just asking because you mentioned endometriosis, so I assume it's women's health.
No, it's very horizontal platform. We're seeing impact across autoimmune issues, across hormonal imbalances, across metabolic things, problems which have a strong genetic component. They are everywhere. Even fertility is actually an aspect that both in men and women, frankly, is a thing that is on decline. And understanding the impact of genetics, of microplastics, of inflammation that has been ongoing is something that's going to help all of these problems very difficult to resolve complex cases, as well as the possibility to get ahead of disease for everyone, for men and women, are all areas where this technology actually helps.
Well, Elena, I wish you all the best with your future development and scaling. And thank you so much for joining me today and for sharing your knowledge and your insights.
Thank you. It was fun to be here, and thanks for having me.